You've been sitting for an hour, and that familiar, creeping ache begins at the base of your neck or deep in your lower back. This discomfort happens because a static seated position physically compresses your spinal discs. Over the next 5 minutes, we will rebuild your desk setup from the floor up, calibrating every component to match your exact body proportions. We will also diagnose your specific posture pain profile to determine which targeted movements will provide you with the most effective relief. Stay seated at your current desk and prepare to adjust your chair as we move through the setup. Eliminating chronic workspace pain begins with a systematic correction of your desk mechanics, starting right now with your foundation. The foundation of your setup is your feet. Plant them flat on the floor, or a footrest, and adjust your chair height until your thighs are exactly parallel to the ground. Your knees require a bend of 90 to 100 degrees. Maintaining this specific angle minimizes the mechanical pressure placed on your lower body joints. Next, check your seat pan depth. You should fit exactly 3 fingers between the seat's edge and your knees. If too deep, the edge presses against your legs, compressing blood vessels and restricting circulation. A properly calibrated lower base anchors your body, preventing your legs from acting as dead weight that pulls your entire skeletal structure out of alignment. To align your upper axis, slide your hips all the way back until your pelvis is fully supported by the chair's backrest. The lower spine requires a natural S-curve to stay healthy. Use a lumbar cushion if your chair does not provide a built-in forward arch to support this area. Pull your keyboard and mouse close to your body. This allows your shoulders to drop and creates a relaxed 90 to 100 degree bend at your elbows. Look straight ahead. Your eyes must align exactly with the top edge of the screen. If the monitor is too low, your head tilts forward into a turtleneck posture, significantly increasing the load on your cervical spine. Aligning the upper axis removes the constant microtensions in your neck and shoulders that otherwise compound into severe fatigue by the end of the day. Even with an optimized desk, sitting produces stress. We can categorize this stress into 2 distinct biomechanical profiles based on your habits. First, test for flexion intolerance. Does your pain flare up when you bend forward or slouch at your desk? Flexion intolerance requires reverse stretches, such as anterior pelvic tilts to restore your back's arch and movements that open the chest. Now, test for extension intolerance. Do you feel pain when leaning back or when maintaining a rigid, military straight posture? Extension intolerance is corrected with posterior pelvic tilts, tucking the tailbone under to relax an overarched lower back. For the forward head posture common to desk work, use the chin tuck. Draw your head horizontally backward without tilting your chin up or down. Identifying your specific intolerance allows you to apply targeted biomechanical maintenance that directly counteracts your muscle imbalances. You now have ideal 90-degree alignment and a supported back. However, maintaining any static position for hours remains a physical trap. Data shows that sitting places 150% more pressure on your lumbar discs than standing. Because of this pressure, the best posture is always your next posture. Breaking your static position is a physiological necessity. Use the 20-20-20 rule to protect your eyes. Every 20 minutes, look at an object 20 feet away for at least 20 seconds. Set a 30-minute recurring timer now. Commit to a 2-minute standing or moving break every time it alerts you. True ergonomic health thrives on a continuous, dynamic cycle, an accurately supported workspace, targeted counter movements, and relentless movement.